I want to talk about birth defects today, how to prevent them. Some of them, of course, are fixable after the baby's born, such as cystic fibrosis, muscular dystrophy, these kinds of things with nutrition. Most of the others will require surgery to take care of. Some are not reducible by surgery or nutrition. You got what you got in some of these. But I want you to get a hold of the book Epigenetics, The Death of the Genetic Theory of Disease Transmission, the DVD, Somebody Needs to Go to Jail, and the CD, Public Enemy #1. And it goes into great detail about what we're going to just spend a few moments on here. Okay? Well, have you ever wondered why so many people who are alcoholics and druggies have so many babies with birth defects? Oh, it must be the drugs and the alcohol. Well, in most cases it isn't. How many vitamins and minerals do alcoholics and drug users buy? None. Okay? So this puts them in a position of high risk because they're not even buying a single sort of lame multiple out there. They're not doing anything. As close as they get to a nutritional supplement is more beer, more wine, more whiskey. Okay? And then you can make some general statements about birth defects. All birth defects are caused by, not genetics. Okay? Genetics has nothing to do with any of the birth defects. All birth defects are caused by nutritional deficiencies or chemicals. There are some herbs in some of the pastures up in the mountains that if a sheep or a cow or a human being eats these herbs, they get cycloptic babies, one-eyed babies, one eye in the middle of their forehead. And then there is some fertilizer things, not much because there's very, very, what should I say, a lot of watching going on in fertilizers, but certainly in the old days there was a thing that overflow fertilizer, particularly nitrates, would cause babies born with thyroid problems, okay? And then you're looking at things like thalidomide, pharmaceuticals. Prescription drugs can have a dynamic effect on the embryo, and a lot of times don't even test the drugs on pregnant laboratory animals to see if they cause birth defects, and shame on them for that. The thalidomide thing, a very sharp FDA agent who was a woman, interesting, and she, I believe, was a physician, and she said, no, you can't sell thalidomide in America because there were some warnings out of Australia and Germany that there were some babies being born without their arms and legs, and mothers that used thalidomide. But they gave it away. They couldn't stop them from giving it away. They just couldn't sell it. And we wound up with about 10,000 babies born in America without arms and legs because of the thalidomide thing. Okay? Well, when you're looking at things like nerve tube defects, of course, we can prevent those things by putting folic acid in our prenatal vitamins. I'm one of the guys, there are 3 guys involved in lawsuits against the FDA in federal court, and I prevailed to make sure that the FDA insisted and required that folic acid be put into the prenatal vitamins. And then we just got another one after the baby's born, of course, the baby formulas, to put selenium into the baby formulas, and that's going to end the SIDS stuff, sudden infant death syndrome, because it's caused not by babies sleeping on their back, is a stupid theory, but that was a theory that went on for, almost 100 years. And then it's actually caused by a deficiency of a single mineral, selenium, and we were able to get selenium required to be put into baby formulas now, so that'll deal with things like SIDS and also cystic fibrosis and muscular dystrophy. Very excited about that. And then, of course, you can have zinc deficiency cause a lot of problems, okay? And we're talking about missing digits, too many digits, missing limbs, too many limbs, 4 arms and 4 leg babies, that kind of stuff. And then cleft lip, cleft palate. They also can get cerebral palsy. It could be a deficiency of zinc or deficiency of folic acid, or a combination of both. When you have babies born with cerebral palsy, and of course there's varying degrees of it based on the degrees of the deficiency, right? And the same thing is true with every birth defect you can name. Very easily prevented. Lead a clean life, and make sure that all your gifts to couples that are sort of dating heavy, as I call it, they're dating heavy, they don't come home, they're getting engaged, they're getting married, don't give them money, don't give them a car, don't give them monogrammed towels, don't give them things like linen sets to start their household. Give them the 90 cents nutrients. Put them on auto ship for them for say 6 months, 9 months, a year after they're getting engaged, after they're getting married, and say, look, I'm going to leave you out of the will here if you don't continue. I'm going to do this for 3 months for you, 6 months, whatever is affordable. But then you got to pick it up and keep going here because there's going to be kids, and I don't want to be the grandmother or grandfather babysitting a special needs child. These sort of damages to the babies is preventable. And so I expect you to prevent it as much as you can by supplementing with the essential 60 minerals, 16 vitamins, 12 amino acids, and 3 essential fatty acids. Okay? And we'll cut the birth defect rate to almost zero by doing this, of course. And so, again, I want you to get the books Epigenetics, the DVD, Somebody Needs to Go to Jail, and the CD, Public Enemy #1, and let's take care of our kids before they're born. We'll be back with Dead Doctors Don't Lie for these messages.
The antioxidants found in many fruits and vegetables are known to help support and promote good health. Research has also shown that dark chocolate, once known as the food of the gods, is rich in healthy nutrients. In fact, dark chocolate is higher in antioxidant content than any other food. Youngevity has combined a proprietary blend of velvety rich dark chocolate with whole fruit pulp and whole fruit juice extracts from mangosteen, goji or wolfberry, acai berry, and cherry, along with vitamins and minerals, producing a smooth, rich, delectable concentrate called Cocogevity. It tastes so great, I sometimes drink it right out of the bottle or pour it over ice cream. Cocogevity is highly bioavailable, meaning your body will absorb and make use of all of these healthy nutrients. If you'd like to learn more about nutritional supplementation, call your local Youngevity associate, and don't forget to ask about home-based business opportunities.
Numerous studies have shown the link between the intake of antioxidants and disease prevention. Foods and supplements are measured in an ORAC scale. ORAC is an acronym for Oxygen Radical Absorption Capacity. In other words, the ability to remove disease-causing free radicals from the human body. Youngevity's Cell Shield RTQ has an ORAC value of 15,800 points per serving. Cell Shield RTQ contains resveratrol, known as an anti-aging compound, turmeric, known for promoting healthy digestion, brain function, immune system, and cellular longevity. Quercetin, a flavonoid, is known for promoting healthy blood sugar metabolism and healthy lung and cardiovascular function. Remove free radicals from your body with Cell Shield RTQ from Youngevity. If you'd like to learn more about nutritional supplementation, call your local Youngevity associate, and don't forget to ask about home-based business opportunities.
Okay, Doug, what pearls of wisdom do you have for us today?
Well, we've had recent stories about, sitting is the new smoking, and this is all these studies have been done in adults. Well, now we've got a study out where they looked at inactivity in children, and the headline of this CNN story is Kid Couch Potatoes Court Long-Term Health Risk. Say long periods of inactivity causes changes in the blood circulation. Even in young children, it may increase the risk of heart disease later in life. Researchers looked at girls between the ages of 7 and 10 for blood flow in their legs before and after they spent 3 hours in beanbag chairs watching movies and playing games on iPads. They also measured the changes in circulation after a similar 3-hour period, except that the children got up and exercised for about 10 minutes every hour. And what they found was that the kids in the veg-out sessions had an association with a 33% decrease in the flexibility of the artery in their thigh, similar to the effect that marathon sitting has been observed in adults. They say, in contrast, there was no difference in blood vessel flexibility in the kids that had the exercise bouts. According to the lead researcher here, Alison McManus, Associate Professor of Pediatric Physiology at the University of British Columbia, says we didn't expect quite such a profound effect in children, partly because children seemed like they could be more resilient to sedentary behavior. The stiffening of the thigh artery in the study could increase the risk of cardiovascular problems by about 25%. The artery did seem to bounce back quickly after they were checked a few days later. They say research in adults has suggested that sitting for long periods for hours on end increase the levels of blood sugar and cholesterol and risk of obesity, heart disease, and even premature death. In the current study, that was the first to look at the physical effects of sedentary behavior in kids. They say another surprise is that young girls were able to sit for so long during the 3-hour session. They only spent about 8 minutes standing or moving their legs. According to McManus, they say we always have this idea that kids fidget, but they are very good at sitting still. Say children today spend about 60% of their waking hours inactive. A current study only involved girls, but they think the effect would hold true for boys as well. That, according to a professor of ergonomics at Cornell University, Alan Hedge. They go on to say there could be a benefit for children standing or moving 10 minutes every half hour. The additional movement could help them remain more alert and maintain good bone and muscle health. So there you go. It's just another situation where it outlines how that sitting for long periods, just the inactivity in our society these days is very detrimental to your health.
Oh, you're exactly right. And, of course, it represents nutritional deficiencies, too. You don't think about it. But when I was a kid, and I'm sure when you were a kid, Doug, we go outside and play chase and tag and hide and seek, and you're all running around out in the playground, sliding down the slides and going around the merry-go-round and all that kind of stuff outside all the time, getting all dusty and dirty and running around screaming and yelling and sweating. But today, everybody's inside playing on their little iPods and iPhones and Kindles and all that kind of stuff. They're doing computer games all inside. And so now we're starting to get the ravages of vitamin D3 deficiency in kids today. They're getting rickets. Rickets in the United States and in the industrialized world in Europe, they're getting rickets, vitamin D3 deficiency, because nobody goes out in the sun anymore. And if they're not taking vitamin D3, vitamin D2, you still need to go out in the sun and activate it, right? And so vitamin D3 is essential today. And, of course, it's in all of our Healthy Start packs, and we actually have little capsules the size of a grain of rice with about 5,000 international units of vitamin D3 in it. We have a little spray, oral spray with about 10,000 international units of vitamin D3 in the spray. And so for kids who are inside all the time playing on their computers and iPads and Kindles and iPhones and so forth, make sure they're getting the 90, and I give them a little bit extra of that vitamin D3 and use it in a capsule form or the spray form. Just computers are causing vitamin deficiencies. We'll be back after these messages. Okay, Doug, let's go to callers.
Let's head to Austin, Texas, and Jeff, you're on with Dr. Wallach.
Hello, Jeb, you're on the air.
Okay, great. Thanks for taking my call. I want to talk with you, Dr. Wallach, about some chronic gout issues I'm having. I've been dealing with it for like 30 years, and over the past 10, it's got to where if I don't take prednisone, I'm disabled, and it's gone to all over my body. And not just in the feet and ankles anymore. It's in knees, wrists, elbows.
Okay. Now, wait a minute. Were you diagnosed with gout with a blood test, or the doctor just say you had gout, or you just say you had gout? Or
I have been diagnosed with a blood test, but it's been a few years since I've admitted to that.
Yeah. Okay. Gout tends to. Yeah, gout tends to affect the large joints in the body, the big toe, the thumb, that sort of thing, sometimes in between the vertebrae. And it's easily managed by drugs, although there's nasty side effects of the drugs. And so I'm surprised that they've given you cortisone and stuff like that, because there's other things that the medical doctors tend to use. But basically, you might not be absorbing the medicine. There's a possibility here. Okay, and so did you have asthma, or did you have skin problems as a kid?
No, sir.
Okay, no acne, nothing like that?
Oh, I had acne as a teenager, but nothing other than that.
Okay.
And I am a pharmacist as well.
Do you have any brothers and sisters?
No, sir.
Okay, you had to think about that, huh? Okay, all right. Basically, you may have a malabsorption problem. That's a maybe, because I don't have enough information to say for sure. Also, gout, of course, is caused by accumulation of uric acid crystals, and it's a signal that your liver is not breaking down uric acid into little short carbon compounds that are harmless. Okay, and so there's several things we've got to do here, and we've got to get you to cut down on the purine-containing foods, such as shellfish, things like peas, beans, lentils, peanuts, okay, legumes. You got to get rid of all the legumes out of your life. You also have to get rid of organ meats. Most people don't mind giving up brains and heart and liver and kidney because they all contain purine, which, if the liver doesn't break them down, you will get uric acid accumulation in the joints, aka gout. Okay? And so, hang on, we'll be back, and we'll give you a program after these messages. Okay, Doug, let's go right back to Texas and Jeff. Okay, let's see here. How much do you weigh, Jeff?
I weigh 210.
Okay, and how tall are you, sir?
About 6 foot.
Okay, and let's see here. You don't have medication for any other diseases, high blood pressure, diabetes, anything like that, arthritis other than gout?
Well, I do have high blood pressure and starting to get some pitting edema in my legs.
Okay.
Actually.
Okay. And let's see here. On the blood pressure, you taking medication for that?
I take some losartan.
Mm-hmm. And how long have you been taking medication?
Actually.
Okay. How long have you been taking medication?
About a year and a half, 2 years.
Oh, okay. Okay. And so you probably looked under the warnings that showed didn't contribute to gout or anything like that. And, of course, you've had gout for 30 years, right?
Yeah, actually, I selected that because it does help with uric acid elimination.
Okay. So anyway, this is a Charmaine thing. Char,
yeah?
What would you do? What would you do, this pharmacist? Let's see if we can save him here. What kind of diet would you put him on?
Well, I'd put him on a gluten-free diet no matter what.
Mm-hmm.
And
Okay.
edema is caused by low blood protein.
That's a possibility, yep. And what other inflammatory foods would you eliminate from his diet other than gluten?
Inflammatory foods?
Yeah, like fried foods and...
Oh, the natural stuff. Well, yeah, everybody should not eat that anyway.
Yeah,
and
no
oils.
fried food.
No
oils.
Meats. No oils.
No oils, yeah, and no processed meats with, like deli slices and, so forth. No oils. That means no microwave popcorn, no theater popcorn, no olive oil, coconut oil, margarine, mayonnaise, salad dressing, cooking oils, and no gluten. Okay. Now, let's see here. What would you do for a supplement program that would give him something to support maintenance repair of the cartilage, ligaments, tendons, connective tissue of the joints, and also reduce inflammation in his joints?
I'd give him 2 healthy bone and joint packs. And then I'd also give him the CM soft gels.
CM Plus. Yeah, the CM Plus capsules. Mm-hmm. Okay, very good. Okay, Jeff, Char's exactly right. I would give you 2 of the healthy bone and joint packs per month. There's 1 per 100 pounds of body weight, and so you take 2 of those. I'd also get an extra bottle of the OsteoFX Plus, and so you can take 3 ounces a day, ounce at breakfast, ounce at lunch, ounce at dinner. I'd also have you take then 2 scoops of the Beyond Tangerine 2.0, which is in the Healthy Bone Joint Packs, at breakfast and 2 at dinner time. That's going to give you the nutrients necessary to support maintenance and repair of cartilage, ligaments, tendons, connective tissue. Also, 3 of the EFA Pluses twice a day, and then 15 glucogel a day. And you want the glucogel that is free of shellfish. We have both with shellfish and without shellfish. You want to get the glucogel without the shellfish. And take 15 a day, 5 at breakfast, 5 at lunch, 5 at dinner. And with the Healthy Bone Joint Packs, you're going to get a wide mouth jar of CM cream. It's a topical application for pain. And I would get also a couple of droppers bottles full of what we call trauma oil. Put the 6 to 10 drops of the trauma oil in a teaspoon of the CM cream, mix it up real good, and apply it to any joint that hurts from your arthritis or from your gout.
Let's head to Toronto, Canada, and Sanjeev, you're on with Dr. Wallach.
Sanjeev, you're on the air.
Thank you, Dr. Wallach, for taking my call. My 15-year-old daughter has some small reddish bumps whenever she takes bath. This has been happening for about 2 months. The bumps are reddish, about 1 to 2 millimeters in diameter, and appear on the side of her face, sometimes on the neck, upper arms, chest, or back. She feels itchy around her jaw area and her shoulders and upper back. If she does not itch, the itch goes away in 5 minutes, and the bumps go away in about 30 to 45 minutes. We've tried changing the shampoos to organic ones with minimal chemicals, soaps, but she has these bumps even when she showers without using shampoo or soap.
Okay. Now, is this something new, or has she had that since she was a small child?
No, this is developed just in the past few months.
Okay. Have you had anything new happen? Did you get a dog and get some dry dog food in the house or anything like that?
No, we do not have any pets. The temperature of the water is very lukewarm. It's not too hot, not too cold. And we've been giving our daughter the Beyond Tangy Tangerine and Longevity plant-derived minerals for about 10 months now.
Mm-hmm. And so the red bumps have just occurred in the last 3 months?
That's correct, yes.
Okay. Do you know if she has an allergy to shellfish?
We have never had shellfish. In her toddler's time frame, maybe older, 5 or 6, she had allergy to penicillin.
Mm-hmm. Okay. And this is like once a week or twice a day, or how often does this happen?
Every time she takes a bath.
Ah, okay. Is this a bath or a shower?
She takes a shower, but what we did was we put water in a bucket and asked her to take bath like that. Even then, they did appear.
Okay, what I would do is have your water tested. Okay? I would have the water tested. Take her to grandma's house or some neighbor's house or your brother and sister's house and see if taking a shower in their shower water, taking a bath in their water does the same thing. And then give us a call back, okay? And then I'll know what to do, okay? But you test her in somebody else's water.
Okay.
Okay, thank you, sir. All right. Okay, Doug, let's go to callers.
Let's head to Jackson, Mississippi. And James, you're on with Dr. Wallach.
Well, James, you're on the air.
Thank you. Hello, Dr. Wallach. I actually met you and shook your hand about 3 years ago. It was July of 2012 when you came to the Muse Center at Hines Junior College. And so I was calling today about my son, who is 31 years old, and got a call from him yesterday. He informed me that he was having outpatient surgery on Thursday of this week. That's tomorrow. Outpatient surgery for deviated septum, and they were going to go ahead and scrape his sinuses while they were in there. My son has had symptoms of snoring and sinus problems ever since he was a teenager. And, of course, I was alarmed and really kind of upset with him that he didn't inform me about the surgery until yesterday. So I've been kind of scrambling to get information to him that it might not be the best thing. So I wanted your opinion on the deviated septum surgery and maybe the scraping of sinus and maybe the better solution instead of the surgery.
Yeah, exactly. Well, you already know my view on unnecessary surgery. Obviously, when there's an emergency, you've been run over by a tank and you're bleeding internally, you need to be cut open and stop the bleeding internally kind of thing. But other than those kinds of things, surgery is rarely useful. There are some heart diseases that might be useful and so forth. But when it comes to sinus problems, chronic sinus problems, postnasal drip and snoring and stuff, oftentimes this is due to just a dairy intolerance, and getting off of milk and cheese and ice cream and things like that stops the snoring and stops the nasal congestion and stops the earaches and stops the sinus stuff. And then there's all these little strips you can buy in the pharmacy that you put on your nose and increases the air passage space by 36 to, 50-something percent, depending on the brand. And, of course, we like to, in situations like this, in addition to changing the diet, getting rid of the dairy out of the diet, we like to use the Healthy Brain and Heart Pack. The Healthy Brain and Heart Pack, 1 per 100 pounds of body weight. We'd also like to throw in the Breath of Life, which is a great aromatherapy oil. The Breath of Life opens up nasal passages, and it's a blend. It's a blend of aromatherapy oils, and so it functions by opening up sinuses and it dilates bronchi and things like that, which allows more easy respiration. We also have an herb nutrition compound, primarily an herb, which is called Sleep Ease. The word sleep dash and then the sort of little acronym EZE, Sleep Ease. Take a couple of those before bed and you'll sleep well. And learning how to sleep on your side or stomach reduces the snoring itself, too. Most people snore when they're sleeping on their backs. And so getting one of those wedge pillows and learning how to do it seems a lot safer than doing surgery. And, of course, you have to read labels because they put milk products, dairy products, and all kinds of stuff. And so that's kind of where I would begin. I would certainly take a couple of months to deal with it in this fashion, as opposed, which is a lifetime change. But you'll know in a couple of months if it's going to work, rather than do these drastic surgeries, because bad things do happen during surgery. Each year in America, medical doctors kill, injure, and infect 15 million patients in their hospitals and clinics. Unnecessary procedures, elective procedures like they're asking your son to go through, not going to be a life-saving thing. It's an elective procedure. And these sort of things, they kill 15,000 people every month, just over the age of 65, with these unnecessary elective procedures. They kill 15,000 seniors over the age of 65. They didn't say how many they kill under the age of 65, okay, with these unnecessary procedures and screening tests. So I would urge you to try these things with your son. I'll be happy to talk with him if he wants to call in. But the first thing is you want to, take him out for dinner and say, look, we'll take you on vacation or something if you just cancel the surgery. Here's a reward for canceling the surgery, and give us 6 months or so to improve your life and either significantly reduce the problems you have or get rid of them by dietary changes in a supplement program, and then give us a call. We'll walk you through it again. Be back after these messages. We're back with Dead Doctors Don't Lie on the ZBS Radio Network. Dr. Joel Wallach for Longevity. Okay, let's go to callers here, Doug.
Let's go to New Jersey. And Les, you're on with Dr. Wallach.
Les, you're on the air.
Hello.
Yes,
I've been taking various supplements for a while. I have some health problems. They didn't cure anything, but they probably prevented some things from getting worse. But the problem now, I'm in a nursing home. And the doctor here is very skeptical. And she did prescribe a D, a B12, and a C, but other than that, she doesn't want me to take any of the, numerous other supplements that I was taking before. And I'd like to know, is there anything I could do to take these supplements, even if the doctor does not want me to?
Well, if you're at home, you're an American, right? You're a free citizen. You can do whatever you want. If you're in a nursing home, you sign papers that turn authority over to them, and they're only going to let you do what the doctor says you can do, okay? And so you're in a situation where you need to talk to the nursing home people, say, look, I want to take my supplements, and I'm prepared to find another nursing home that will allow me to do that. I'd like it here. You know, you guys are nice, but I'm going to look for a nursing home that will let me take my supplements if you don't let me use my supplements. Okay?
Well, I'm afraid
that's what you got to do.
But I'm afraid that any other place, the doctors may be the same. You know, they're almost.
Well, they will be the same unless you sign the form and say, I'm going to sign in for you, but I need to be able to take my vitamins and minerals. I want to do that. And if they say no, you say, okay, sorry, you're not the guy. No, sorry, you're not the guy. Yes, we'll let you do that. Okay, then I'll go with you. And, of course, in the telephone book and the yellow pages on nursing homes and all kinds of centers and things, rehab centers and stuff for people, going through surgery and whatnot. There's all sorts of these things around. So you want to kind of shop around a little bit, get on the telephone, and go down through the telephone book, and you'll find one that will let you take your vitamins and minerals. You're going to have to talk to them because they have hired a doctor who they are going to follow what the doctor says. Because if something bad happens and they don't follow what the doctor says, well, then the doctor gets off the hook, but they get nailed by a big lawsuit. And so obviously the odds of anything bad happening from vitamins and minerals is pretty low, but unless somebody hits you with a bottle. But it's one of those things where at home you can do darn well what you want because you're an American. But once you sign those papers giving the nursing home the power and the doctor there on the staff are consulting with them, the power to pick and choose what you can and can't do, then you're kind of locked in. Okay? They won't. If you get some there when you're asleep, they'll just take them away. And so it's you've got to get all that done through the nursing home staff, through the manager, the head of the staff, and so forth, and talk with them and see if you can't amicably get them to let you do the thing you want to do with your vitamins and minerals. But if they won't do it amicably, say, okay, look, I've got to start looking for another place because I have to have my vitamins and minerals, and if you won't let me have them, I will find another place to go to that will let me do it. And let me know when you find the place. Let me know how it all works out because you're in a no-win situation there. Okay, Doug, how much time we got?
Just a little less than 30 seconds.
Well, I'm going to take and remind everybody to get my new book, Epigenetics, The Death of the Genetic Theory of Disease Transmission. It's kind of a 25-year update on Dead Doctors Don't Lie. It doesn't replace it. It's kind of like the next 25 years. And it's all new research that shows that everything I said 25 years ago in Dead Doctors Don't Lie was exactly correct. And it's really, really interesting to see how many times I was correct, okay? Literally thousands of times. And so Epigenetics, The Death of Genetic Theory of Disease Transmission will be a great read. It's a lot of fun. And it will help you understand why you need to supplement with the 90 for Life program. And thank you so much, Shar. Super job as usual. Sorry, I had a lot of complicated things today, so I didn't get to call on you as much as we normally do. Thank you so much, Doug and Richard. Superlative job as usual. God bless each and every one of you. God bless our troops, and God bless America.
Hi everyone, Andy Anderson here. Are you using those handy little bottles of gel that zap germs, bacteria, and other nasties? In today's world, that's smart, especially with all the filthy doorknobs, shopping carts, and handrails we touch every day. Here's what you may not know. Once the alcohol evaporates, goodbye effectiveness. No more protection until you use it again. PureWorks to the rescue. Our FDA-compliant foam, lotion, soap, and spray do not rely on alcohol. Their killing power lasts up to 4 hours. PureWorks disinfecting spray is EPA certified to kill swine flu, bird flu, MRSA, HIV, hepatitis B and C, and a whole host of viruses and bacteria. Mold and fungus too. It's even safe around children and pets. You'll love the soft feel of PureWorks on your hand. It actually conditions and will not dry your skin. Here's a little peace of mind knowing your hands are still germ-free hours later. Get your hands on PureWorks and get PureWorks on your hands. Stand by. Pull out your paper and pencil for your local number to order PureWorks.
When you perspire, working or playing, your body is losing more than just water. That's why it tastes salty. But what you're sweating out is more than just salt and potassium, as some sports drinks will have you believe. One of the most well-known sports drinks only has 2 nutrients, and it's loaded with sugar. Some have a mineral or two with a couple of vitamins. Youngevity's exceptional sports drink, Rebound FX, is chock full of cancer-fighting antioxidants, a full spectrum of vitamins, plant-derived minerals, and herbs. Rebound FX is a highly absorbable liquid supplement that gives you quick, sustained energy. Rebound FX supports cardiovascular health, immune health, and boosts stamina and energy. Don't short yourself during and after your workout with just a couple of nutrients. Drink Youngevity's Rebound FX for optimal health. If you'd like to learn more about nutritional supplementation, call your local Youngevity associate, and don't forget to ask about home-based business opportunities.
If you've been diagnosed with type 2 diabetes, prediabetes, or the metabolic syndrome, and you're tired of seeing your blood glucose levels rise and fall like a ship on the ocean, but you don't want to take those drugs the rest of your life, Youngevity has an alternative. A product called Sweeties has been developed just for you. Used as part of your regular diet, Sweeties helps maintain healthy blood sugar levels, a formulation specially designed to nutritionally assist your body with the regulation of your blood sugar level. Sweeties supports healthy glucose metabolism because it's fortified with aspartic acid, chromium, and vanadium, all to help you promote healthy blood sugar levels. If you want to get off those drugs and control your blood sugar metabolism naturally, try Youngevity's Sweeties product. If you'd like to learn more about nutritional supplementation, call your local Youngevity associate, and don't forget to ask about home-based business opportunities.
You've listened to physician and veterinarian Dr. Joel Wallach help many people on the Dead Doctors Don't Lie talk radio program. You've also heard hundreds of people tell how Dr. Wallach and Youngevity products have changed their lives. If you're now convinced that Dr. Wallach is onto something and you want to try Youngevity's premium quality products for yourself, we can connect you with a distributor that serves your local area. Simply call our special helpline voicemail at 313-444-3463. That's 313-444-3463. Call right now and leave your name, telephone number, or email address, and we'll see to it that the right person contacts you shortly. Remember, the phone number, 313-444-3463. That's 313-444-3463. Call now to change your life. That's 313-444-3463. You've listened to physician and veterinarian Dr. Joel Wallach help many people on the Dead Doctors Don't Lie talk radio program. You've also heard hundreds of people tell how Dr. Wallach and Youngevity products have changed their lives. If you're now convinced that Dr. Wallach is onto something and you want to try Youngevity's premium quality products for yourself, we can connect you with a distributor that serves your local area. Simply call our special helpline voicemail at 313-444-3463. That's 313-444-3463. Call right now and leave your name, telephone number, or email address, and we'll see to it that the right person contacts you shortly. Remember, the phone number, 313-444-3463. That's 313-444-3463. Call now to change your life. That's 313-444-3463.
I am Judy DeVilbus. Here I am speaking to you again. I just wanted to tell you that recently I started drinking the Whey Shakes again, the chocolate Whey Shake. And you need to remember, the Whey Shake isn't just for losing weight. It's a fantastic place to get your great protein. And if you're trying to gain weight, you can take it along with your meals. And the best part is, if you want to just have a great protein shake, do like I do. Put it over ice, stir it up, and you can sip on it for 20 minutes to an hour. I do it every single day. I absolutely love it. You need to get back to it too. It's really good for you. And it makes not fat, but it makes muscle after you work out. And you can also mix it up in a blender with an egg, and you have the most incredible health protein shake. Or mix it with a little water, stir it up, and you have a little pudding. And who doesn't like pudding?
For more information or to order, call your Youngevity distributor today. And don't forget to ask about Youngevity home-based business opportunities. Imagine a rich, decadent chocolate that's actually good for you. Youngevity's Triple Treat chocolate is just that, an antioxidant-rich dark chocolate complete with probiotics to aid in proper digestion. This all-natural product contains no preservatives, and for those with dietary restrictions, it's gluten-free, dairy-free, glycemic-friendly, and kosher certified. Not only does Triple Treat dark chocolate taste fantastic, it contains super antioxidant blueberries to absorb free radicals with an ORAC value of 16,936 per piece. Triple Treat chocolate also contains a proprietary blend of probiotics with over 500 million live healthy bacteria per 8 grams at the time of manufacture, with 80% reaching the intestines, which is much more than most live culture yogurts. If you'd like to learn more about nutritional supplementation, call your local Youngevity associate, and don't forget to ask about home-based business opportunities.
Hey, if you're like me, your life is hectic. You don't know where you're going to be next. Between kids and family and in-laws and work and traffic and everything else that's driving me crazy right now, my life is insane. I bet your life's insane as well. When do we have time to get every single nutrient we need to be healthy? When? Well, I've got a tip for you. Take a product called Pollen Burst. It's so simple, even I can do it. All you have to do is open the package, pour it in water, mix it up, and bam, you're ready to go. It tastes great. It's not one of those medicine tasting things. It tastes great, low in calories, helps curb your appetite, gives you natural energy that doesn't let you crash, gives you your vitamins, minerals, nutrients, everything from the plant world. And I gotta tell you, for a busy person like me or a busy person like you, we need simple, we need good. Pollen Burst is your answer. Tastes great. Try it, and you'll feel better.
Call your local Youngevity distributor to find out how Pollen Burst can make you feel better. And don't forget to ask about home-based business opportunities. You've listened to physician and veterinarian Dr. Joel Wallach help many people on the Dead Doctors Don't Lie talk radio program. You've also heard hundreds of people tell how Dr. Wallach and Youngevity products have changed their lives. If you're now convinced that Dr. Wallach is onto something and you want to try Youngevity's premium quality products for yourself, we can connect you with a distributor that serves your local area. Simply call our special helpline voicemail at 313-444-3463. That's 313-444-3463. Call right now and leave your name, telephone number, or email address, and we'll see to it that the right person contacts you shortly. Remember, the phone number, 313-444-3463. That's 313-444-3463. Call now to change your life. That's 313-444-3463. You've listened to physician and veterinarian Dr. Joel Wallach help many people on the Dead Doctors Don't Lie talk radio program. You've also heard hundreds of people tell how Dr. Wallach and Youngevity products have changed their lives. If you're now convinced that Dr. Wallach is onto something and you want to try Youngevity's premium quality products for yourself, we can connect you with a distributor that serves your local area. Simply call our special helpline voicemail at 313-444-3463. That's 313-444-3463. Call right now and leave your name, telephone number, or email address, and we'll see to it that the right person contacts you shortly. Remember, the phone number, 313-444-3463. That's 313-444-3463. Call now to change your life. That's 313-444-3463.
Hi, this is Dr. Joel Wallach, your host of Dead Doctors Don't Lie. If you're interested in a colon cleanse, blood cleanse, liver cleanse, in the classical herbal way, you want to ask your Youngevity associate for Herbal Rainforest. Herbal Rainforest has 16 herbs, 16 cleansing herbs, classic cleansing herbs, and 77 plant minerals. That's right, and these are all organic. It doesn't get any better than that. In your busy day, and you're around all these toxins out there in your workplace, on the way home, going to work, in your food, in the air, in the water, you need Herbal Rainforest. I guarantee you, it will give you a cleanse. You can control the dose. It's a liquid. It tastes good. It doesn't get any better than this. A colon that's happy makes you happy. Nothing better than a happy colon. Herbal Rainforest. Clean it out.
For more information on this product or others you've heard about on the Dead Doctors Don't Lie radio program, call your local Youngevity associate today. And don't forget to ask about home-based business opportunities.
Greetings, everyone. Judy DeVilbus here. What do you think of when you hear the words tangy tangerine? Well, I think of like a sweet, tangy tasting something. Well, what I'm referring to is the ultimate tangy tangerine. It's a fantastic product. It has everything you need, and a great benefit is it's very, very delicious. It's very easy to drink. I've suggested it even to youngsters. Even children like it. Even little guys. Even little girls. They come right into my office. Their parents can't get them to take those chewables, and besides that, they're not as good as tangy tangerine. And I give them a little taste of that, and you know something? They're pleased as punch. So, if it's good for a child and it tastes delicious, why not you? There's no excuse not to take a vitamin when it tastes as good as that does. So how about it? Tangy tangerine should be the answer to all of your nutritional program problems.
For more information or to order, call your Youngevity distributor today. And don't forget to ask about Youngevity home-based business opportunities.